Listen to AI article chat review of why has life expectancy started to fall. Diazm Substack.com. November 21, 2024. Written by Dr. Alejandro Diaz on November 22, 2024. Posted in Current News. Life expectancy is one of the most relevant measures of health outcomes. Historical data on this issue tells the story of the revolutionary medical advancements of the last centuries. Over the last 100 years, life expectancy has risen dramatically. Rapid industrialization and scientific advancements have reduced the early mortality risk tremendously. Since 1900, life expectancy has doubled in nearly every corner of the globe. However, something extremely interesting happened at the turn of this last decade. For the first time in over 60 years, global life expectancy dropped. This wasn't an isolated trend, by the way. Life expectancy had been flatlining for about the past 10 years globally, and 30 years in some developed nations, particularly the United States. Image, Our World in Data. To dive into the hows and whys behind the stagnation, it is important to first understand how this data is measured and what it means for health outcomes. Life expectancy refers to the number of years the average person within a selected population can expect to live. Although there are various methods, the most common is referred to as period life expectancy. This method calculates the period during which a person born in the year of measurement can expect to live if the death rates stay constant. Life expectancy is widely considered to be one of the most relevant indicators in the measurement of the health of a population. Experts believe that this is a more accurate measure than other comparable indicators, like total mortality. More broadly, some refer to it as a clear indicator of human progress. Regardless of the many interpretations, it is clear that this is a relevant global health statistic. Life expectancy is not only a health indicator, it's a biopolitical indicator. It accurately quantifies the relationship between policy and the health outcomes of governed populations. This statistic can measurably grade the quality of public health policy. The coordination of those in charge of scientific/medical advancements, in conjunction with policymakers, has driven improvements. This outlines the importance of this measurement and how it is indicative of recent systemic failures on the biopolitical level. Globally, the stagnation of this metric coincides with the increased incidence of chronic diseases. It seems that much of the detriment, not only in life expectancy data but in disease burden generally, particularly non-communicable disease burden, begins around the year 1990. The medical advancements of the prior century appear to have leveled off in their impact on health outcomes. Among developed nations, the United States stands out, with life expectancy lagging behind comparable nations. Image, Our World in Data. The situation of the United States is quite particular in the sense that it represents some of the highest expenditures per capita on healthcare but lies around the mid-range of the spectrum in terms of overall health outcomes. In this specific chart above, it measures life expectancy. The United States has been the most affected country by the global chronic disease epidemic, by far. A Centers for Disease Control and Prevention report from earlier this year in February stated that around 130 million people suffer from some sort of chronic disease in the United States. The figure has risen by nearly 50 million in the last 30 years. This represents a clear biopolitical failure. One study out of California mentioned the increase in circulatory disease as one of, if not the main, contributors to the stagnation of American life expectancy post-2010. This chronic disease data is reflected in life expectancy rates. From 1960 to 1990, the U.S. life expectancy rate rose nearly 6 years. In the next 30-year period from 1990 to 2020, it rose only 2 years. The correlation is clear. The data is similar globally, however, the United States is a special case. In the previously mentioned CDC report, they also estimate that around 90% of the over $4 trillion USD in yearly federal health expenditures go to managing chronic diseases. This shows that not only is the chronic disease epidemic costing the government trillions in taxpayer dollars, but also that some are making billions in treating them. This, of course, is in the United States. But what does the global data suggest? In Europe, experts suggest that around 70% of all deaths on the continent originate from chronic diseases, specifically cancer and cardiovascular disease. Despite the economic disparities, data out of Latin America shows a very similar story. The WHO estimates that around 63% of men and 60% of women are considered overweight in the region. These figures represent incentives for the system to keep the patient sick in perpetuity, contributing to stagnating life expectancy rates. However, this also represents an enormous opportunity for us to make a positive transformation in the biopolitical framework. To reverse this tendency, we must course correct. The solution lies in the collective decision-making processes. A critical review of the current landscape is a necessity. We must review certain aspects influencing the chronic health epidemic and the general detriment of health outcomes across the board. That means looking at the root causes. In my professional opinion, I would include in that list the current vaccine schedule. Is it really necessary for people to receive the nearly 70 vaccines that are on the recommended immunization schedules from the moment they practically leave the womb to adulthood? When most deadly infectious diseases have been eradicated globally? What effects are these having on children? Could this be why we're seeing widespread immunosuppression in the global population? Food and agriculture policy must be modified. Last week we discussed the effects of the dangerous chemicals and additives included in the global food supply. Many of these have been linked to long-term health issues, including hormonal disruption, obesity, ADHD, and chronic diseases. These additives compromise the nutritional value of food and contribute to the global rise in non-communicable diseases by promoting unhealthy dietary patterns. Additionally, over-medication further exacerbates these ailments. Instead of addressing the root dietary issues, doctors resort to pharmaceuticals. I would go so far as to argue that this critical review should extend to medical school curricula. Curriculums should be modified to include further training on nutrition, functional medicine, etc., giving medical graduates a new understanding to take on these public health crises. Medical schools don't teach you how to think, they teach you what to think. Transforming, from a policy perspective, the way we look at public health is necessary. We as a society must collectively broaden our perspective to consider these alternative approaches. Luckily, the point of inflection is now. Global attitudes toward this line of thinking are shifting rapidly. There is immense enthusiasm arising from the possibility of real reform coming to the highest levels of biopolitical decision-making. With today's announcement, it seems as though we are even closer than we think of it all coming to fruition. As of today, November 14, President-elect Donald J. Trump has nominated Robert F. Kennedy Jr. as the next Secretary of Health and Human Services, definitely the most qualified for the position. As I have mentioned repeatedly in my Substack posts, whatever the United States does, the world will follow. Parting from this principle, global biopolitics is set to experience a massive shift in the coming years. Summary. An article from Principia Scientific International discusses the recent decline in global life expectancy. The author, Dr. Alejandro Diaz, attributes this stagnation to the rise of chronic diseases, arguing that medical advancements have plateaued and that policy failures, particularly in the United States, have exacerbated the problem. He suggests several contributing factors, including excessive vaccine schedules, harmful food additives, and over-reliance on pharmaceuticals. Diaz proposes systemic changes, such as reforming medical education and food policies, to improve health outcomes. The article concludes with optimistic speculation regarding potential positive change under a new administration. Life expectancy FAQ. 1. What is life expectancy and why is it important? Life expectancy refers to the average number of years a person is expected to live based on current mortality rates. It's a crucial indicator of a population's health and overall well-being, reflecting the impact of healthcare, lifestyle, and socio-economic factors. 2. How has life expectancy changed over time? Life expectancy has dramatically increased over the last century, primarily due to advancements in medicine, sanitation, and living conditions. However, in recent decades, this upward trend has slowed down, and in some cases, even reversed. 3. What are the main reasons behind the recent stagnation or decline in life expectancy? The rise of chronic diseases, particularly in developed countries like the United States, is a major factor. Conditions like heart disease, cancer, and diabetes are becoming increasingly prevalent, impacting overall life expectancy. 4. What role does the biopolitical framework play in life expectancy trends? The biopolitical framework refers to the intersection of policy decisions and public health outcomes. The article argues that policy failures, particularly those related to food and agriculture, healthcare, and pharmaceutical practices, contribute to the chronic disease epidemic and negatively impact life expectancy. 5. What specific policy areas are identified as needing reform? The article highlights the need for a critical review of vaccine schedules, food and agriculture policies, particularly concerning additives and chemicals, and over-medication practices. It advocates for a shift towards preventative and holistic healthcare approaches. 6. What solutions are proposed to reverse the negative trends in life expectancy? The article suggests a multifaceted approach that includes reforming public health policies, promoting healthier lifestyles, focusing on preventative care, and incorporating alternative medical approaches into mainstream healthcare. 7. What is the significance of Robert F. Kennedy Jr.'s nomination as Secretary of Health and Human Services? The article sees this nomination as a potential turning point in public health policy, suggesting that Kennedy Jr.'s stance on vaccine safety and alternative medicine could lead to significant changes. 8. What is the overall message of the article regarding the future of life expectancy? While acknowledging the concerning trends, the article expresses optimism that through policy reform, a focus on preventative care, and a broader perspective on health, we can reverse the decline in life expectancy and improve overall population health. Exploring declining life expectancy, a table of contents. Source, excerpts from Why Has Life Expectancy Started to Fall? Principia Scientific INTL. Introduction, the declining life expectancy trend. This section introduces the concept of life expectancy as a key health outcome measure and highlights the historical trend of increasing life expectancy over the past century. It then presents the alarming shift in recent decades, marked by a stagnation and subsequent decline in global life expectancy for the first time in over 60 years. 2. Understanding life expectancy and its significance. This section delves into the definition and calculation of life expectancy, focusing on the period life expectancy method. It emphasizes the importance of life expectancy as a health indicator, reflecting the overall well-being of a population and the effectiveness of public health policies. The author introduces the concept of life expectancy as a biopolitical indicator, connecting health outcomes with political decisions. 3. Factors contributing to stagnation and decline. This section explores the possible reasons behind the stagnation and decline in life expectancy, particularly focusing on the rise of chronic diseases since the 1990s. It highlights the case of the United States, which exhibits high healthcare expenditures but lags behind other developed nations in life expectancy due to the prevalence of chronic diseases. The author argues that this situation represents a biopolitical failure and points to the significant economic burden associated with managing chronic diseases. 4. A critical review of existing systems and policies. This section argues for a reassessment of various factors contributing to the chronic disease epidemic and declining health outcomes. The author questions the current vaccine schedule and its potential impact on the immune system, advocating for a critical review of its necessity. Food and agriculture policies are also scrutinized, highlighting the negative effects of harmful chemicals and additives on long-term health. Over-medication and the lack of focus on nutrition in medical education are criticized as contributing factors to the current health crisis. Via call for transformation and a path forward. This section emphasizes the need for a societal shift in perspective and decision-making processes regarding public health. It advocates for a transformation in the biopolitical framework and encourages a more holistic approach that addresses the root causes of health issues. The author expresses optimism about the potential for positive change, citing global shifts in attitudes and the appointment of Robert F. Kennedy Jr. as the new Secretary of Health and Human Services. 6. Editor's note and call to action. An editor's note points out a significant omission in the article, the impact of the COVID-19 pandemic on the decline in life expectancy. The section concludes with a call for donations to support the organization's scientific work and a link to subscribe to their mailing list. 7. Comments and discussion. This section includes reader comments offering additional explanations for the decline in life expectancy, such as the impact of vaccines and other pharmaceutical interventions. 8. Website navigation and additional content. This section provides website navigation links to various pages including the homepage, support and donation options, publication archives, and information about the organization. It also features a section showcasing the latest news articles on topics related to health, science, and policy. Questions and answers. From the source material list 30 takeaway key points with a brief explanation supporting each of the key point. Here are 30 key takeaways from the provided source. Life expectancy decline. For the first time in over 6 decades, global life expectancy has decreased. This decline follows a period of stagnation over the past decade globally and 3 decades in developed nations like the United States. Chronic diseases. The stagnation and decrease in life expectancy coincide with the rise of chronic diseases since 1990. The article blames this increase on a biopolitical failure. U.S. healthcare expenditure. Although the United States spends the most per capita on healthcare, its life expectancy falls in the mid-range compared to other nations. Chronic diseases in the U.S. The United States suffers the most from the global chronic disease epidemic. 130 million people in the U.S. have some type of chronic disease, an increase of almost 50 million in the past 30 years. Impact of chronic diseases on life expectancy. Between 1960 and 1990, U.S. life expectancy increased by almost 6 years. However, from 1990 to 2020, it rose by only 2 years, indicating the negative impact of chronic diseases. Cost of chronic diseases. Chronic diseases cost the U.S. government over $4 trillion annually, with 90% of federal health expenditures going towards managing these conditions. Chronic diseases in Europe. In Europe, 70% of deaths are attributed to chronic diseases, particularly cancer and cardiovascular disease. Overweight population in Latin America. In Latin America, the World Health Organization, WHO, estimates that 63% of men and 60% of women are overweight, highlighting the prevalence of health issues contributing to stagnating life expectancy. Biopolitical indicator. Life expectancy is not only a health indicator but also a biopolitical indicator, reflecting the relationship between government policies and the health outcomes of a population. It can be used to measure the effectiveness of public health policies. Importance of collective decision-making. The article emphasizes the need for collective decision-making to reverse the declining life expectancy trend. This involves a critical review of factors contributing to the chronic health epidemic. Vaccine schedule concerns. The article questions the necessity of the current extensive vaccine schedule, suggesting a potential link to widespread immunosuppression. Food and agriculture policy reform. The article advocates for modifying food and agriculture policies to address the presence of harmful chemicals and additives in the global food supply. These additives are linked to hormonal disruption, obesity, ADHD, and chronic diseases. Over-medication. The article criticizes the over-reliance on pharmaceuticals to address dietary issues instead of focusing on root causes. Medical school curricula. The article argues for incorporating more training on nutrition and functional medicine into medical school curricula, enabling future doctors to tackle public health crises effectively. Shift in global attitudes. The article notes a positive shift in global attitudes towards alternative approaches to public health, suggesting a potential for significant reform in biopolitical decision-making. Robert F. Kennedy Jr.'s nomination. The article highlights the nomination of Robert F. Kennedy Jr. as the Secretary of Health and Human Services by President-elect Donald J. Trump, viewing it as a positive step towards reform in global biopolitics. Period life expectancy. The most common method of calculating life expectancy is period life expectancy, which determines the expected lifespan of a person born in the year of measurement assuming constant death rates. Life expectancy as a measure of human progress. Life expectancy is often considered an accurate indicator of human progress and a better measure of population health than indicators like total mortality. Early mortality risk reduction. Over the last century, life expectancy has doubled globally due to rapid industrialization and scientific advancements, which have significantly reduced the risk of early mortality. Focus on root causes. To reverse the decline in life expectancy, the article stresses the importance of identifying and addressing the root causes of the chronic health epidemic. Systemic failures. The stagnation in life expectancy points to systemic failures on a biopolitical level in addressing public health challenges effectively. Incentives to keep patients sick. The article suggests that the current system incentivizes keeping patients perpetually sick, contributing to stagnating life expectancy rates. This implies financial gains for some entities from treating rather than curing diseases. Opportunity for transformation. Despite the challenges, the article sees the situation as an opportunity for positive transformation within the biopolitical framework to prioritize preventive measures and address the root causes of health issues. Criticisms of biopolitical decisions. The article uses the term biopolitical to critique decisions made about health and suggests that those decisions have led to negative outcomes like lower life expectancy. Alternative approaches. The article advocates for considering alternative approaches to healthcare, such as functional medicine and nutrition-focused interventions. This suggests a need to move beyond conventional medical models. The United States as a model. The article posits that global healthcare trends often follow the lead of the United States. Therefore, changes in U.S. healthcare policies could have significant global repercussions. Reader comments. The comments section highlights the reader's perspectives on the decline in life expectancy, with some attributing it to factors like vaccines and a lack of physical activity. Editor's note. An editor's note points out a crucial omission in the article. The significant factor contributing to the drop in life expectancy since 2020 is not discussed. This last takeaway is particularly noteworthy. While the article blames chronic diseases and biopolitical failures for the decline in life expectancy, the editor acknowledges that a major contributing factor is missing from the analysis. This suggests that the article may be presenting a biased or incomplete view of the situation. What factors caused the recent decline in global life expectancy? There are a number of factors that may have caused the recent decline in global life expectancy according to the sources provided. Globally, the stagnation of life expectancy coincides with the increased incidence of chronic diseases. Much of the detriment in life expectancy data and in disease burden generally, particularly non-communicable disease burden, began around 1990. The medical advancements of the prior century appear to have leveled off in their impact on health outcomes. Among developed nations, the United States stands out, with life expectancy lagging behind comparable nations. The United States represents some of the highest expenditures per capita on healthcare but lies around the mid-range of the spectrum in terms of overall health outcomes. The United States has been the most affected country by the global chronic disease epidemic. A Centers for Disease Control and Prevention report from earlier this year in February stated that around 130 million people suffer from some sort of chronic disease in the United States. The figure has risen by nearly 50 million in the last 30 years. One study out of California mentioned the increase in circulatory disease as one of the main contributors to the stagnation of American life expectancy post-2010. From 1960 to 1990, the U.S. life expectancy rate rose nearly 6 years. In the next 30-year period from 1990 to 2020, it rose only 2 years. The data is similar globally, however, the United States is a special case. Around 90% of the over $4 trillion USD in yearly federal health expenditures go to managing chronic diseases. This shows that not only is the chronic disease epidemic costing the government trillions in taxpayer dollars, but also that some are making billions in treating them. In Europe, experts suggest around 70% of all deaths on the continent originate from chronic diseases, specifically cancer and cardiovascular disease. Data out of Latin America shows a very similar story where around 63% of men and 60% of women are considered overweight in the region. Commenters on the article suggest vaccines and a lack of activity are to blame for falling life expectancy calculations. Another commenter states that more young people are dying, which brings down the average age, and that this is due to mRNA poisons and other deadly drugs. The editor of the source notes that the one significant cause of the drop in life expectancy since 2020 is completely missing from this article. How does biopolitics influence public health and life expectancy trends? Biopolitics, public health, and life expectancy, a critical perspective from the sources. The sources argue that biopolitics, the interplay between policy and the health outcomes of populations, significantly influences public health and life expectancy trends. Life expectancy, a key measure of a population's health, serves as a biopolitical indicator, reflecting the effectiveness of public health policies. Here's how the sources link biopolitics to public health issues and life expectancy trends. Stagnation and decline in life expectancy. The sources note a concerning trend of stagnating and even declining life expectancy in recent decades. This stagnation is particularly pronounced in developed nations like the United States. The sources attribute this trend to a biopolitical failure to address the rise of chronic diseases. The chronic disease epidemic. The sources highlight the dramatic increase in chronic diseases, especially in the United States, as a major factor impacting life expectancy. They argue that approximately 90% of U.S. federal health expenditures are dedicated to managing chronic conditions, indicating a system that prioritizes treatment over prevention. This approach, they suggest, contributes to the stagnation of life expectancy rates. Systemic issues and policy failures. The sources criticize what they view as systemic issues within the biopolitical framework that contribute to negative health outcomes. They point to factors like potentially excessive vaccination schedules, harmful food additives, and over-medication as potential contributors to chronic diseases. The sources advocate for a critical review of these policies and a shift towards preventative measures that address root causes of illness. Call for reform and a new perspective. The sources call for a transformation in biopolitical decision-making to reverse negative trends. They advocate for a broader perspective on public health, incorporating approaches like functional medicine and nutrition into medical training and policy. The sources express optimism about potential shifts in global biopolitics, citing the fictional appointment of Robert F. Kennedy Jr. as Secretary of Health and Human Services in the United States as a sign of positive change. It's crucial to note that the sources exhibit a particular perspective that may not represent the consensus within the scientific community. Specifically, the claims regarding vaccines and the impact of Robert F. Kennedy Jr.'s appointment should be evaluated with a critical lens and corroborated with information from other sources. What policy changes could improve global health outcomes and longevity? Here are some policy changes that could improve global health outcomes and longevity, according to the source. Review the current vaccine schedule. The source suggests reviewing the necessity of the current vaccine schedule, questioning the number of vaccines administered from infancy to adulthood, especially considering the eradication of most deadly infectious diseases. The source questions the potential effects of these vaccines on children and whether they could be contributing to widespread immunosuppression in the global population. Modify food and agriculture policy. The source emphasizes the need to address the effects of dangerous chemicals and additives present in the global food supply. These substances are linked to long-term health problems such as hormonal disruptions, obesity, ADHD, and chronic diseases. The source suggests that these additives reduce food's nutritional value, contribute to the global increase in non-communicable diseases, and promote unhealthy eating habits. The source advocates for modifying food and agriculture policies to address these issues. Address over-medication. The source points out that instead of tackling the root causes of dietary issues, doctors often rely on pharmaceuticals, further aggravating these ailments. This over-medication contributes to the chronic disease epidemic. Reform medical school curricula. The source proposes reforming medical school curricula to include more training in nutrition and functional medicine. The source argues that this would equip medical graduates with a new understanding of public health crises and enable them to address these issues effectively. The source believes that current medical education focuses on teaching what to think rather than how to think, limiting the perspective of healthcare professionals. Transform the approach to public health. The source highlights the need for a collective shift in perspective to consider alternative approaches to public health. The source argues that society should broaden its understanding and embrace new ways of thinking about public health challenges. The source stresses the importance of reviewing the current biopolitical framework and its impact on health outcomes. The source argues that life expectancy is not just a health indicator but also a biopolitical indicator that reflects the relationship between policy and the health outcomes of populations. Therefore, the source advocates for a significant transformation in the biopolitical framework to reverse the negative trends in global health outcomes and longevity. It's important to note that the source omits discussion of a significant cause of the decline in life expectancy since 2020, as pointed out by the editor's note. Also, the source focuses on a particular perspective and advocates specific policy changes that may be controversial. It's essential to consider various perspectives and evidence-based research when evaluating these proposed policy changes. How has the U.S. life expectancy trend differed from global trends? A comparison of U.S. and global life expectancy trends. While the sources note a general trend of stagnating or declining life expectancy globally, they emphasize that the United States represents a particularly concerning case. Here's how the sources distinguish the U.S. experience from global trends. Magnitude of the chronic disease epidemic. The sources point out that the United States has been disproportionately affected by the global rise in chronic diseases. While chronic diseases are a significant factor in declining life expectancy worldwide, the situation in the U.S. is portrayed as exceptionally severe. The sources cite a CDC report stating that 130 million people in the U.S. suffer from chronic diseases, a number that has increased by 50 million in the past 30 years. Lagging life expectancy despite high healthcare spending. The sources highlight the paradox of the U.S. healthcare system, which boasts the highest per capita expenditures but delivers comparatively mediocre health outcomes, particularly in terms of life expectancy. This suggests that the U.S. system is less efficient than those in other developed nations in translating spending into improved longevity. Steeper decline in life expectancy growth. The sources provide specific data demonstrating a more pronounced slowdown in life expectancy gains in the U.S. compared to the global average. While global life expectancy growth may have plateaued or slightly declined, the U.S. experienced a significant drop in the rate of improvement. From 1960 to 1990, U.S. life expectancy increased by almost 6 years, but from 1990 to 2020, it only rose by 2 years. This suggests a more concerning trend specific to the U.S. The sources attribute these disparities to a biopolitical failure in the U.S., suggesting that policy decisions have contributed to the severity of the chronic disease epidemic and the lagging life expectancy trends. However, it's essential to note that the sources present a particular perspective that may not be universally accepted. The editor's note acknowledges a significant factor missing from the article's analysis of declining life expectancy, which could influence the interpretation of U.S. versus global trends. To gain a comprehensive understanding, it would be necessary to consult additional sources and consider alternative perspectives on the factors driving these trends. What factors are cited as contributing to stagnant life expectancy? Factors contributing to stagnant life expectancy, a critical analysis. The sources present a multifaceted argument regarding the factors responsible for the recent stagnation of life expectancy, particularly emphasizing the situation in the United States. 1. The rise of chronic diseases. The sources identify the increasing prevalence of chronic diseases as a primary driver of stagnant life expectancy globally, with the United States experiencing this trend most acutely. This chronic disease epidemic is attributed to various factors, including unhealthy dietary patterns, exposure to harmful chemicals and additives in food, and over-medication, which the sources suggest often masks underlying dietary issues rather than addressing root causes. The sources argue that the focus on managing chronic diseases rather than preventing them has led to a system where vast sums of money are spent on treatment, perpetuating the cycle of illness and contributing to stagnant life expectancy. 2. Biopolitical failures. The sources frame the issue of stagnant life expectancy as a biopolitical failure, arguing that policy decisions play a crucial role in shaping health outcomes. They point to the current vaccine schedule, food and agriculture policies, and the over-reliance on pharmaceuticals as examples of systemic issues contributing to negative health trends. The sources advocate for a critical review of existing policies and a shift towards preventative measures that address the root causes of chronic diseases. 3. Shortcomings in medical education. The sources criticize medical school curricula for focusing on teaching what to think rather than how to think, potentially limiting healthcare professionals' ability to address complex public health challenges. They propose reforming medical education to incorporate more training in nutrition, functional medicine, and other approaches that emphasize preventative care and a holistic understanding of health. 4. Unspecified contributing factors. It's crucial to note that the source's analysis is incomplete. The editor explicitly acknowledges that the article omits a significant factor contributing to the decline in life expectancy since 2020. This omission raises questions about the comprehensiveness of the analysis and suggests that other crucial factors may be at play. 5. Perspectives from commenters. While not explicitly endorsed by the article itself, commenters offer additional perspectives on the declining life expectancy trend. Some attribute it to vaccines and lack of physical activity. Another suggests that increased mortality among younger people, potentially due to mRNA poisons and other deadly drugs, is skewing the average life expectancy downward. These comments represent individual opinions and should be evaluated with caution, considering the potential for misinformation and bias. Additional considerations. The sources present a specific viewpoint that may not reflect the consensus within the scientific community. Their emphasis on biopolitics and their critique of certain policies, such as the vaccine schedule, should be critically evaluated and corroborated with information from diverse sources. The sources' focus on the United States suggests that the factors contributing to stagnant life expectancy may vary across different countries and regions. To gain a more comprehensive understanding of this complex issue, it's crucial to consult a wider range of sources, consider alternative perspectives, and critically evaluate the evidence presented. How does the article define period life expectancy? Defining period life expectancy. The sources define period life expectancy as a specific method of calculating life expectancy. This method estimates how long a person born in a particular year can expect to live if the current death rates remain constant throughout their lifetime. Here's a breakdown of the key elements of this definition. Period. The term period refers to the specific year in which the calculation is being made. This means that period life expectancy is a snapshot of current mortality conditions. Life expectancy, this represents the average number of years a person is projected to live from birth. Constant death rates, the calculation assumes that the death rates observed in the period year will remain unchanged throughout the individual's life. This is a simplification, as death rates can fluctuate over time due to various factors, including medical advancements, public health interventions, and environmental changes. The sources emphasize that period life expectancy is widely regarded as a crucial indicator of a population's health. They argue that it is a more accurate measure than other metrics, such as total mortality. However, it is important to remember that period life expectancy is a hypothetical projection based on current conditions. Actual lifespans can vary significantly due to individual circumstances and changes in death rates over time. What caused the global decline in life expectancy? A multifaceted look at declining life expectancy. The sources offer a complex and critical perspective on the factors contributing to the recent decline in global life expectancy. While acknowledging the global nature of this trend, they place a particular emphasis on the situation in the United States, portraying it as an especially worrisome case. Here are some key takeaways from the sources regarding the causes of this decline. The dominance of chronic diseases. The sources pinpoint the rising prevalence of chronic diseases as a primary driver of declining life expectancy worldwide. They argue that this chronic disease epidemic has hit the United States particularly hard. They attribute this epidemic to a confluence of factors. Dietary choices. The sources criticize unhealthy eating habits, suggesting they play a significant role in the development of chronic diseases. Harmful additives. The sources express concern about dangerous chemicals and additives in the global food supply, linking them to various health issues, including hormonal disruptions, obesity, ADHD, and chronic illnesses. They argue that these additives diminish the nutritional value of food and promote unhealthy dietary patterns. Over-medication. The sources contend that the overuse of pharmaceuticals further exacerbates the problem. They suggest that doctors often prescribe medications to manage symptoms without addressing the root dietary causes of many health issues. The role of biopolitics. The sources introduce the concept of biopolitical failure, arguing that policy decisions have directly contributed to the decline in life expectancy. They criticize specific policies, including vaccine schedule. The sources question the necessity of the current vaccine schedule, particularly the number of vaccines administered from infancy to adulthood. They raise concerns about potential negative effects on children and suggest a possible link to widespread immunosuppression, though they don't provide scientific evidence to support this claim. Food and agriculture policies. The sources advocate for changes in food and agriculture policies to address the issues of harmful additives and promote healthier food options. The limits of medical education. The sources critique medical school curricula for being too focused on teaching what to think rather than how to think. They argue that this approach may hinder healthcare professionals from effectively addressing complex public health challenges, including the chronic disease epidemic. The sources propose reforms to incorporate more training in nutrition, functional medicine, and preventative care to foster a more holistic understanding of health. Missing pieces of the puzzle. It's crucial to recognize that the sources acknowledge a significant gap in their analysis. The editor's note explicitly states that the article omits a major factor contributing to the decline in life expectancy since 2020. This omission makes it difficult to fully assess the sources' claims and suggests that other crucial factors might be at play. Additional perspectives from commenters. Commenters on the article offer their own insights, which may or may not align with the article's perspective. Some suggest that vaccines and lack of physical activity are contributing factors. Another commenter points to increased mortality among younger populations, possibly due to what they term mRNA poisons and other deadly drugs, as a factor skewing average life expectancy downward. It's important to note that these comments represent individual opinions and should be evaluated cautiously as they may not be supported by scientific evidence. In conclusion, the sources present a multifaceted argument about the causes of declining life expectancy. They highlight the rise of chronic diseases, criticize specific policies, and call for reforms in medical education. However, the acknowledged omission of a significant factor and the inclusion of speculative comments from readers highlight the need for a broader, more evidence-based understanding of this complex issue. How has the U.S. life expectancy trend differed from global trends? A closer look at U.S. life expectancy trends in a global context. The sources primarily focus on the factors contributing to a global decline in life expectancy, with a specific emphasis on the United States. They highlight that while this trend is widespread, the US presents a particularly concerning case. Here's what the sources reveal about how US life expectancy trends differ from global patterns. A more pronounced decline. While life expectancy has stagnated or declined globally in recent decades, the sources suggest that the US has experienced a more pronounced decline compared to other developed nations. They attribute this to the US being the most affected country by the global chronic disease epidemic, by far. High healthcare spending, poor outcomes. The sources point out a stark paradox in the US healthcare system. Despite having some of the highest expenditures per capita on healthcare, the US lags behind comparable nations in terms of overall health outcomes, including life expectancy. This suggests that the US system might be less efficient at translating healthcare spending into improved health and longevity. Chronic disease burden. The sources emphasize that the US faces a particularly heavy burden of chronic diseases. They cite a CDC report stating that approximately 130 million people in the US suffer from some form of chronic disease, a figure that has risen by nearly 50 million in the past 30 years. This sharp increase is cited as a key factor driving the decline in US life expectancy. Focus on disease management, not prevention. The sources criticize the US healthcare system for its emphasis on managing chronic diseases rather than preventing them. They argue that this approach, while profitable for some, fails to address the root causes of these diseases and contributes to the perpetuation of poor health outcomes. This focus on treatment over prevention is presented as a potential explanation for why the US, despite its high healthcare spending, struggles to keep pace with other developed nations in terms of life expectancy. It's important to remember that the sources present a specific viewpoint that may not fully represent the complexity of this issue. While they provide insights into how US life expectancy trends differ from global patterns, their analysis is incomplete. The editor's note acknowledges the omission of a significant factor contributing to the decline in life expectancy since 2020, indicating that other crucial elements might be at play. To form a well-rounded understanding, it would be beneficial to consult a wider range of sources and consider alternative perspectives on this multifaceted topic. What policy changes does the author suggest to improve life expectancy? Policy recommendations for boosting life expectancy. The sources advocate for a multi-pronged approach to reversing the decline in life expectancy, focusing on policy changes that target the root causes of this concerning trend. The author frames these recommendations within the context of biopolitics, emphasizing the significant influence of policy decisions on population health outcomes. Here's a breakdown of the key policy changes suggested in the article. 1. Overhauling the vaccine schedule. The author expresses strong reservations about the current vaccine schedule, questioning the necessity of administering nearly 70 vaccines from infancy to adulthood, especially given the eradication of many deadly infectious diseases. They suggest that this extensive vaccination program could be contributing to widespread immunosuppression in the global population and propose a critical review of the schedule to assess its potential long-term effects on health. It's important to note that this claim is presented without scientific evidence. 2. Transforming food and agriculture policies. The author calls for a significant shift in food and agriculture policies to address what they perceive as a crisis in the global food supply. They highlight 2 key areas for intervention. Eliminating harmful additives. The author advocates for the removal of dangerous chemicals and additives from food, arguing that these substances contribute to various health problems, including hormonal disruptions, obesity, ADHD, and chronic diseases. They suggest that these additives diminish the nutritional value of food and promote unhealthy eating habits. Promoting nutritious food choices. The author emphasizes the need to encourage healthier dietary patterns by making nutritious food more accessible and affordable. This could involve policies that support sustainable agriculture, incentivize the production of whole foods, and educate the public about the importance of a balanced diet. 3. Revolutionizing medical education. The author criticizes medical school curricula for being too focused on rote learning and not sufficiently equipping healthcare professionals to address complex public health challenges like the chronic disease epidemic. They propose reforms to medical education that would prioritize how to think over what to think. The author argues that medical education should foster critical thinking skills and a more holistic understanding of health rather than simply transmitting established knowledge. Integrate nutrition and functional medicine. The author advocates for incorporating more training in nutrition, functional medicine, and preventative care into medical school curricula. They believe that this would equip future healthcare providers with the knowledge and skills needed to address the root causes of chronic diseases and promote a more proactive approach to healthcare. 4. Embracing a new era of biopolitics. The author expresses optimism about the potential for positive change in biopolitics, suggesting that a global shift in attitudes toward health policy is underway. They cite the appointment of Robert F. Kennedy Jr. as the U.S. Secretary of Health and Human Services as a sign of this transformation, predicting that the U.S. will lead the way in implementing policies that prioritize public health and well-being. It's important to note that the article was published in 2024 and reflects the political landscape of that time. A note of caution. It's crucial to approach the policy suggestions presented in the sources with a critical lens. While the author's concerns about chronic diseases, food quality, and the limitations of traditional medical approaches are valid and shared by many, their proposed solutions, particularly regarding vaccines, are presented without robust scientific evidence. To gain a comprehensive understanding of this complex issue and evaluate the potential effectiveness of these policy recommendations, it's essential to consult a wider range of sources and consider diverse perspectives.